My research study is a continuation of a previously funded National Eye Institute study investigating the feasibility of telerehabilitation in low vision rehabilitation. You may be wondering, what exactly is low vision? Low vision is defined as a visual impairment or vision loss which cannot be corrected with glasses, contact lenses, surgery, or medication. Ocular conditions such as glaucoma, diabetic retinopathy, and age-related macular degeneration contribute to the visual impairment in the United States. Vision impairment is among the top 10 causes of disability in the US. The number of visually impaired individuals have increased drastically over the years. In 2004, it was estimated that 3.5 million Americans older than 40 years of age had low vision. Low vision now has an estimated prevalence of 5.7 million in the United States. Cases are actually predicted to double by the year 2050. Vision impairment increases significantly with age. 70 to 85% of all low vision care is provided to older adults. It is estimated that by 2030, 1 in 5 people will be elderly, increasing the cases of low vision and the demand for low vision rehabilitation. Low vision also affects individuals younger than 40 years of age. In 2013, it was estimated that more than 2 million individuals younger than 40 in the United States were visually impaired. Medical costs attributable to vision impairment have been estimated to be $5.5 billion per year, while the financial cost associated with the loss of quality of life has been estimated to be $10.5 billion per year in the US for individuals older than 40 years of age. The economic burden of vision loss among children and adults younger than 40 years of age in the United States was estimated to be $27.5 billion in 2012. Low vision causes difficulty performing daily activities and often results in loss of driving ability as well as independence. Individuals with visual impairment often experience difficulty with mobility as well as difficulty performing simple tasks such as reading, which can negatively impact their quality of life. It has been shown that low vision increases the risk of depression and anxiety, contributes to medication mismanagement, and increases the risk of mortality. Fortunately, low vision rehabilitation is used as an intervention tool to improve a patient's ability to perform various tasks. Low vision rehabilitation involves a wide array of services, which includes, but is certainly not limited to, assessment of visual function, recommendations of optical and non-optical low vision aids, train on how to use those specific aids, as well as psychological services. Low vision rehabilitation involving the prescription and training on use of prescribed low vision aids typically occurs in the office. There is usually an initial assessment followed by in-office training sessions. However, access to low vision care is low due to many various barriers. These barriers include transportation, physical disability, and chronic illness of individuals who are visually impaired. In addition to these barriers, COVID-19 has created an additional barrier. Telerehabilitation may provide a solution to these barriers by allowing providers to deliver personalized low vision care to individuals from the comfort of their home. Telerehabilitation uses the internet to remotely provide low vision rehabilitation using a video format. In the initial National Eye Institute study, local Lions Club members from the Fort Lauderdale area were enlisted to enter patients' homes and set up the hardware that was required for conducting the telerehabilitation visits. In my study, we have implemented a novel concept which actually utilizes remotely accessing a smartphone to set up telerehabilitation visits. Patients present to the exam for their initial low vision rehabilitation. They're provided with the device that is recommended, as well as provided with a smartphone. A scheduled appointment is then set up for the telerehabilitation visit. The patient simply turns the smartphone on and the low vision provider remotely accesses the smartphone to set up the video conference. During this video conference, the low vision provider actually goes ahead and basically trains the patient on how to use the optical device that was recommended in their initial visit. They also have the opportunity to do an assessment of the patient's home environment to make any recommendations that might improve the patient's ability to perform specific tasks. Using this strategy, patients continue to obtain low vision care from the comfort of their homes.